Today on In Conversation, we had in the studio with us Michael Martineau, eHealth consultant and commentator. Michael, thank you for joining us. You were at an event yesterday with Greg Reid, the new CEO of eHealth Ontario. Can you maybe give us the precis?
Sure. So this was arguably his first public event, arranged by iTac Health, and it was an opportunity for him to meet and talk to the vendor community. And so he chose, rather than to do a long speech with PowerPoints and et cetera, to basically to call it Greg Reid Unplugged, stood up without aid of any props, talked for about 10 minutes on his kind of musings on what he's seen so far, and then stood for 90+ minutes taking questions from the vendor community. He did extremely well in my view. He answered questions directly without hesitation. The man is extremely articulate, thinks quick on his feet. In cases where he didn't have an answer, he was quite happy to say that he didn't have an answer. And in a few rare cases, if it was outside of his purview, he would say that as well. So all in all, feedback that I heard from people was that they were impressed. He was communicating the right message. He was willing to engage with the community. He doesn't seem to have a fixed vision for where eHealth Ontario should go, but in fact is willing to consult with people to refine the vision. So all in all, I say a good first public appearance.
Yeah, what was the tenor of the questions?
Oh, they ranged all over the place. A lot of it had to do with procurement, not surprising given it was a vendor briefing. So wanted to know how vendors could get a fair hearing. Would the playing field be level, given some of the issues with the previous regime? That was a big issue. Wanted to know how to streamline the process. The recent diabetes registry has been a long, drawn-out, very expensive process. And in fact, Greg committed to doing a post-mortem on that process afterwards to see what worked, what didn't, and how they could refine it. Interestingly, at the start of the session, the MC offered to take emails on his BlackBerry and to ask questions anonymously. People didn't feel like speaking up. I got up to speak and I made a comment that I thought this was a little unusual, but perhaps indicative of the environment we've created. And Greg responded by committing to an open process, one in which all vendors would have a fair shake and that they should not feel in any way intimidated by speaking their minds. So he very much seems to want to engage with all parties.
Yeah, I got the impression already from Mr. Reid that there's going to be a lot more transparency in this regime than in the previous regime. That's important.
I think that's absolutely critically important. It's certainly one of the biggest issues that I hear from people with whom I speak, readers of my blog, is openness and transparency is sadly lacking across various organizations that are involved in eHealth in this country, not just eHealth Ontario. People want to have much more insights to how decisions are made, want to have input, want to know their input is listened to. So yeah, there's a huge and growing demand for openness and transparency. So I think it's good that he's reacting to that. I'm not sure that doing that in a government milieu will be as easy as he thinks. That's certainly some of the private feedback I've had, but he's certainly got the right intent.
He seems to have acknowledged, I mean, I was following your Twitter feed during the event, and he seemed to be very upfront about acknowledging that rehabilitating the reputation of eHealth Ontario is probably job one.
Yeah, as he put it, and I liked his phrase, he said, we're in the penalty box, and we're going to have to serve our time in the penalty box. And that he felt the best way to gain credibility within the public was actually by doing. Let's get some results. And that's a message he's been communicating internally to his staff. He's communicating externally to us. No amount of talking, in his view, is going to fix the credibility issue. They've got to do, and they've got to do well. So, yep, he knows it. He knows his job. He knows the challenge he's got. And I think he's got some good thoughts about how to get there.
So what do you think we can see in terms short-term? In terms of steps that Mr. Reid will be taking?
Well, the good news is, and if you go through the Auditor General's report, the Auditor General had no major concerns with the strategy in place, other than that he would like to see it extend beyond 2012 as it currently exists. So there are a number of initiatives and programs within that strategy that the organization has been working its way through and can continue to work through. So we're going to see a number of those come through this year, diabetes registry being probably the big one. There's a number of projects coming up around integrations to how we start to integrate these various silo systems that we have. So we're going to see a number of programs come through with now with Greg at the helm. So the good news is there is a plan, they can execute on it, and we'll start to see some action. In addition, we're going to see work at the local levels. So I met last week with one of the Lynn CIOs, Local Health Integration Network CIOs, and they've just got some of their funding in place finally. So they're starting to ramp up their projects. So we'll see it both at the regional, local level, as well as now some of the provincial projects rolling out. So finally, I think in Ontario, we're going to start to see some e-health activity.
Right, so what would Mr. Reed's relationship with the Lynns, how do they work with each other?
And I think that's an outstanding question. In fact, one of the people from the audience was from the Lynn. He asked that question. And as Greg indicated, that's an issue that he's got to sort out. Part of what he wants to figure out is what is eHealth Ontario's role versus what is the Lynn role versus what is the hospital role. And as far as he's concerned, that's an outstanding question that he needs to go back and re-engage the community. And he actually talked about, and I posted in my blog today, 4 different scenarios that he can see for possible roles that he's put up as straw man that now he wants to go out and discuss with the community. So that's an open question, is what their role is versus the Lynn role.
And that Lynn role is very important because most health services are delivered locally.
Yeah, I mean, I think something on the order of 80–90% of our interactions with the healthcare system occur within a relatively small geographic area, often referred to as a referral pattern. So, yeah, getting those projects going, getting results at the local level are probably the most important way we can get short-term tangible benefits from the application of IT.
Now, isn't there a bit of a risk when you have all these local initiatives being developed, when further down the road we have to make these interoperate? Isn't there a risk of that kind of siloing?
Yeah, there is, but I would, two answers I would give to that. First, so what? Quite frankly, I think if we can drive some local projects that get tangible benefits, that we get providers and the patients using the technology. If it works, we've got to replace some of that going forward. I think that the benefits we can receive are far outweigh the cost of doing some of that replacement. Secondly, and one of my big soapboxes, if you read my blog, has to do with standards. So I think we need to drive national standards, and unfortunately we're doing a lot of our standards work at the provincial level. So it's a good example, and I've been giving Mr. Reed a hard time about this, is we're developing an e-referral standard for Ontario when Infoway has a pan-Canadian e-referral standard. So why are we not looking to evolve the Infoway standard rather than creating yet another standard? So we need to work hard at national standards so that these projects can adopt those national standards, work at the local level, and as they evolve, they can start to interoperate.
Great. Michael, thanks so much for joining us.
Thank you.
Thanks.